Well, it would be real easy to think that the threat of COVID is over. And if you want to think that, your head's in the sand. Dr. Kevin Cavanaugh is a retired physician and founder of a national, becoming international organization called Health Watch USA. He joins us now. Dr. K, good morning.
Good morning, Jack.
CDC and FDA authorized Pfizer and Moderna vaccine for kids starting at 6 months of age. What can you tell us about that?
Well, it was passed overwhelmingly by the committees. They are, along with the CDC, very much encouraging parents to partake in this vaccine. It is a lower dose than what is given in older children and adults. I believe the Pfizer-BioNTech vaccine is only 3 micrograms of vaccine, and it's given over 3 doses, as the Moderna is a higher dosage, but given over 2 shots. So that's important, and parents need to get their kids vaccinated. They have a choice. For me, whichever one's available is the one you should get. But if you do have 2 options, there's a choice of getting your child vaccinated more quickly with a stronger dose versus stringing it out over a longer time, but the dose being lower. And of course, if you're worried about those exceedingly rare complications, then one may want to go with the Pfizer dosage regime. But in view of our increased caseload, getting your child vaccinated quickly, I think, is imperative.
Now tell us about the Kaiser Foundation and their survey.
Well, Kaiser surveyed parents, and this was done approximately a month or so ago. It wasn't just last week, but they found that a very small percentage of the parents are going to be getting their children vaccinated. Only 18% are planning to get their children vaccinated right away. And you need to remember that although you hear a lot about deaths are exceedingly rare, hospitalizations are rare, although both can still occur, we don't know the long-term effects of this virus on children, and children have the potential of spreading it to their caregivers. So that if you certainly have caregivers that are at high risk at home, you want to go on ahead and get your children vaccinated. At least that would be my recommendation, and I would talk to your doctor about that. Make sure that everything else is, of course, okay for your children. But the CDC, FDA have overwhelmingly support that children should be vaccinated down to the age of 6 months.
How are we doing in Kentucky in relation to COVID?
We're doing terrible. We're 49th in the nation. This is according to the Commonwealth Fund. And that's not good. I tell you, Jack, there's a lot of deaths, a lot of hospitalizations, and a lot of long COVID that I feel could have been avoided. One of the things that you're going to be hearing over and over again is that this virus isn't causing deaths as often, that it is milder. And that's kind of true, but what was really the truth is the virus isn't changing as much as people are getting more immune. And unless you're up to date on your vaccinations, you're not as immune as you could be, and it puts us at risk. And with the new variants out there, the BA.4 and BA.5 variants, there's some laboratory data that vaccination is probably better than getting, for example, infected with the Omicron variant, because people didn't get a huge immune response with Omicron compared to other variants. So vaccination is key. You can get your immunity up. And when I say vaccinated, I mean also boosted, because a 2-dose vaccine does not give you much, if any, protection. Likewise, if you're boosted with 1 booster, but you're more than 5 months out, you're not going to have much protection. So keep up to date on your vaccinations. Keep your immunity as high as you can.
Another factor that makes things rather confusing is they're talking about not getting the J&J booster, but you have the choice of Moderna or Pfizer. And I understand that an ER doc used 2 factors to decide on Moderna instead of Pfizer for vaccinating his toddler. Is there, for people, I'm not talking about toddlers now, but for people, adults, between Pfizer and Moderna, is there one better than the other as far as you know?
Well, right now, because we have such high viral spread, especially in Kentucky, I myself would opt for Moderna because you're going to get your child immune much quicker. With Pfizer, it's very important to get 3 doses. After 2 doses, there's not much protection, but both vaccines, it's stated that you have an 80% efficacy rate when the full course has been administered. So get your child vaccinated. Personally, I would hedge more towards the Moderna if it's available. If it's not, get Pfizer. Both are going to give you the same, but one's a little quicker than the other. Of course, you can say, hey, Pfizer, that may be a little milder as far as reactions during the vaccination. I want to go that route. It's going to be a lot up to the parent. And of course, consult with your physician. Very, very important.
So before we wrap up here this morning, let's talk about long COVID. Now, that continues to be a concern, does it not?
Well, it is, and it's a real thing. There was another study out. These studies seem to be coming out almost weekly, and this was out of Brigham's and Women's Hospital. And they found that over half of the individuals with long COVID had circulating viral antigens up to a year after infection. Now, that may sound scary, but this is a virus, and viruses tend to hang around within the body a long time, especially if, for example, it's COVID, unfortunately. But the thing that this points out to is that this is what we would call a biomarker, that long COVID is real. That's the importance of this study. It doesn't say how severe it is, but it's real. And these patients weren't all hospitalized or very sick. These were just typical long COVID patients. So this is another study that is saying long COVID is real. It's affecting memory, cognition, brain fog. We hear that all the time. There's risks of heart disease, and you can get damage to your body with the virus even after the acute phase lapses. So just don't be focusing on deaths. I still consider a dangerous virus, especially if you're above the age of 50. You're going to want to get that second booster. And right now, with Fayette County being in the CDC's red zone, and that's red based on cases plus hospitalizations, I would recommend, along with the CDC's recommending, wearing masks on indoor settings and taking precautions, because we don't want to get our hospitals filled, because then people can't get treated for other diseases. So we really do need to be careful with this virus.
Dr. Kevin Cavanaugh, thank you so much.
All right. Thank you, Jack.